few minutes.
All right, Emily, thank you. Given that Maine is the oldest state in the nation, it shouldn't surprise anyone that more than a quarter of our population is enrolled in Medicare. This means many older Mainers will be impacted by the program changes announced by the Centers for Medicare and Medicaid Services that go into effect next year. Jen Burke from the Maine Credit Union League joins us now to offer some insight on how these changes might financially benefit Medicare recipients in 2025. It's kind of a complicated issue for people to understand, Jen.
Yeah, well, the Medicare system is very complex, but it's a lifeline for so many individuals, particularly those here in Maine. So it's important to know about the changes and some of the benefits that are going to be coming to Mainers next year and for folks across the country. One of the biggest benefits that I see happening is lower prescription drug costs in the sense that those who have a Medicare Part D prescription drug plan, their annual out-of-pocket expenses are going to be capped at $2,000. So that's good news. That's a little bit of a reduction. In addition, for folks that have a Medicare prescription drug plan, including a Medicare Advantage plan, you're now going to be able to take your out-of-pocket expenses and spread those out across the year. So you can do monthly installments. That's a big advantage to Mainers that are living on fixed incomes, to be able to break out those big expenses over the course of the year.
Sure.
For those Mainers who are on a Medicare Advantage plan, starting next July, they're going to get notification about supplemental benefits that they haven't been using. I mean, that's really important too. If you have benefits that are going unused by July, you want to kind of know what those are and how to access them. So that's a change in the program. And then beginning next year, folks who sell Medicare Advantage plans or prescription drug coverages, they're no longer going to be able to receive financial incentives for selling plans. The jury will be out on how that will actually benefit people, but the goal behind that change is to alleviate potential deceptive, practices as far as marketing and selling goes. So, all good changes that seem to be coming down that will hopefully help older adults.
And so when do you think people need to begin thinking about their plans for next year?
It's such a great question. Open enrollment doesn't begin until October 15th, but it's May. So you've already started your healthcare journey for the year. How is your current plan working for you? Are you spending more than you anticipated? If you already know now that you are, then come October, you want to shop around for another plan. Basically, I think the best recommendation I can give anyone is to plan ahead. Take a look at how you're spending, how your plan is working for you, and if it's not working, when the plans become available in October, see if there's something else out there that better suits your needs. From a financial standpoint, you can never be over-prepared.
Yeah.
So start kind of taking an inventory now and seeing what's working for you or what's not working for you so you can make changes.
Yeah, and I think one of the great benefits that you mentioned is the fact that they're going to let you know what you're not using.
Next year.
Right.
Yes.
Yeah, so
for those Medicare Advantage plans, supplemental benefits, I mean, those are benefits that are on the table. And if you use them or you don't use them, they go, it goes to waste. So don't
leave them on the table.
Not when it comes to your health care or your finances.
Right. All right. Jen Burke from the Maine Credit Union League, thank you so much for coming in.
Thank you.
And now here's a look at what else is coming up today on Channel 8.